Hi, Dr. Pelto here. I want to do a deep dive about a condition called Sever's disease. This is for you if you have a child that's younger, that plays soccer, that has pain in the heel region. When you squeeze the heel, your child getting out of bed has pain, pain wearing cleats, pain with jumping, pain that kind of all of a sudden started and you're not sure what's going on. Most likely, if you have a child that's dealing with this, the condition is called Sever's disease. The technical term is called calcaneal apophysitis. The calcaneus is the heel bone, and the apophysis is the area where the tendon inserts into the heel, and that's an area where it can be inflamed right at the growth plate. And we're going to go over all the types of treatments and specifically some of the common questions that you might have with your child if you're dealing with this. So we'll kind of get into this. So the first thing to, even before you start watching this, is to determine how long have you had the symptoms. There are two different phases in dealing with Sever's disease or calcaneal apophysitis. One is an acute condition, and the other one is more chronic. If it's been over a couple of months, then it's probably turned more into the chronic treatment, and the acute is treated a little bit differently. With an acute condition, you can use anti-inflammatories, you can use icing, shoe changes, and it might calm it down. When it's become more chronic, if it's been there for months, 2 months, 3 months, 6 months, and many times I find that patients are delayed in seeing a provider because they're so involved in the sports. Pretty much everyone that I see with this condition plays sports. And as their sports intensity increases, they tend to have more of the symptoms with this condition. You also have to look at what treatments have you tried before you go to see a provider. There are certain things that you can do on your own. You can do a short course of anti-inflammatories like Motrin or ibuprofen. You can do icing or something called contrast baths, where you put your foot in a bucket of kind of ice or really cold water for 5 minutes, and then 5 minutes in warmer hot water, and then ice again. And those are things that can help reduce inflammation. And then how it affects your child's life or your life. If it's painful pretty much every single day, that's a big effect. If it only hurts after sports, that's different. Or if it only hurts in your cleats, that's a little bit easier to deal with. So let's look a little bit at what is Sever's disease. If you think about this word calcaneal apophysitis, you have to imagine the Achilles tendon. It inserts into the back of the heel, and the Achilles always pulls upward. So as you're walking, the Achilles is what pulls to move your foot, so your foot can push off the ground. And when you do that, that pull is going to be at an area of a growth plate in the back of the heel. Kids, when they're growing, they have a growth plate back there. And as it pulls, it's going to cause slight shifting in that growth plate, and that many times can cause pain on that growth plate. That's what this condition is caused by. Patients and parents, when they come in, they're not sure, but the real simple way is to say it's a painful inflammation of the heel growth plate. Now, what ages does it affect kids? Because girls mature sooner than boys, it happens to girls earlier. So for girls, it's between the ages of 8 and 13. And for boys, it's between the ages of 10 and 15. And what we find that there are certain activities, as I mentioned before, specifically I hear of kids playing soccer, kids in cleats, kids maybe running, jumping, and playing, things that you want kids to do. Once you stop growing, once your growth plate closes, it's not going to be an issue. The challenge is, how do you get to that level where it's not going to be painful? I like to use an example of a dysfunction symptom index to explain this a little bit. I have patients, they come in, the parents say, well, my son, he's always been playing sports. He's always been playing soccer, things like that. But there are certain things, if you look at this index, on one axis, you have dysfunction. And there are many things that can cause dysfunction, both in kids and adults. It could be a flat foot, which is also called a pronated foot. It could have less movement due to a tight heel cord. There could be more movement because they're more active. They could have tightness. They could have new change in a shoe. They could have a different foot type, a high arched or low arched foot type. They could have some type of a deformity of their foot, or there could be more impact, meaning they're jumping or running, or there's different surfaces such as playing indoor or outdoor. And all of those dysfunctions, they can, over time, as kids get older or as it can cause more symptoms. And what I find with this condition specifically is they go over the symptom line because of some type of inactivity. And our whole goal is just to put them back under the symptom line and keep them without symptoms until their heel feels better, or until they mature. And one of the questions I get from patients, they say, well, why does my foot hurt even if I didn't injure it? Kids, they don't come in saying they've injured their foot. It's not because you've fallen. It's not because of that. It's just because it's anatomy. You're growing. Sometimes this can even be equated with a growth plate issue. Why do I only have pain in one foot? That's another question that I get. Thankfully, Sever's normally is just in one foot. Otherwise, you're going to be quite painful. I'm not sure. It's not exactly sure if it's due to the dominant foot, but thankfully, it's usually just one foot at a time. And some kids, they have recurrent issues with it. So why did it go away in the past and then come back? That's a question that I get from parents. And many times it's due to tightness. For example, tightness in the back of the calf, types of shoes, type of activity, and then how long will it take to get better? It really depends on how active you are in terms of your activity. I find these days kids, they just keep going and going, and they never take any time off. And so in order to get better, it can be a challenge. You may have to slow down your activity and not just change what you're using in your shoes. So specifically, what causes Sever's disease? As I mentioned before, it's jumping, it's sports, it's overuse, specifically with shoes and cleats that don't have any cushion. A tight Achilles tendon, the technical term for that is equinus, which is a tight calf muscle. And you can test that by lifting up your ankle and seeing how far it goes above the ground position or the neutral position. Most kids, as they're growing, they might have a really tight calf or something called equinus, and that can be an issue. Also, growth spurts. What we find with growth spurts is that the foot grows faster than the tendon. So the tendon stretches to grow up, and that's going to put more tension on that growth plate in the back of the foot. Okay. What are the symptoms? So the symptoms that kids tell me is they have pain to the back or the bottom of the heel, and they are limping around. And the telltale sign is you take the side of the heel and you squeeze it, and it really hurts. Some have it so bad that they're even walking on their toes, and they have difficulty jumping, they have difficulty running, and as I mentioned before, that squeezing. So if you want to test your child, you take the side of the heel, you squeeze it, and you see if it's painful. How do you diagnose it? I think the exam is really sufficient for most of my patients, but we tend to get x-rays still. And we look at the x-rays, we look at the growth plate. That can help explain it. And you can explain to the patient, well, this is where the tendon inserts. This is why it's pulling and shifting. Occasionally, we do need an MRI as well. But for most patients, I think an x-ray is sufficient. So how do you treat Sever's? We're going to go and talk about all of the treatments that exist, even some of kind of these newer types of treatments that you might want to consider. But basically, if it is an acute, once again, if it's something that's new, less than 2 months, you can try to get rid of it yourself, see how that works by reducing activity, specifically reducing the impact, supporting or cushioning your heel. You can try oral anti-inflammatories like Motrin or ibuprofen. If your doctor allows you, topical creams sometimes work. Icing can sometimes work. Specifically, reducing the tightness on the back of the calf. That can be with foam rolling, can be with stretching, can be with physical therapy. And we're going to go into much more detail talking about that. I have a little graph that I made called the Sever's treatment evaluator. It's the same thing that I use for Achilles tendonitis and a lot of these other ones. But it talks about certain types of treatments that are more effective and other types of treatments that are less effective for my patients. Some of my patients ask me some questions, and this is what I like to go over. They want, well, what should I avoid? What should my patient avoid when they have Sever's? Well, you want to avoid going barefoot, because going barefoot offers no cushion and it offers no support. One way to help the Sever's is having a high contouring orthotic in your shoe that's going to take pressure off the heel. Another thing that you should avoid, not doing your exercises. If you want to get better, you kind of need to do the shoe changes and you need to do the exercises, which would include foam rolling and stretching. So if you don't stretch and if you don't foam roll, And if you continue to do all this impact, such as jumping and running and things like that, it's going to continue to get aggravated. And that's one of the challenges I find with kids, is that they're so intense with their sports, they don't want to take any time off. What are the common misconceptions that people have with Severs? Patients come in, they think they have plantar fasciitis in these little kids. No, little kids don't have plantar fasciitis. And the other misconception is they look at the x-ray and they see the growth plate and they think it's a fracture. Normally, it is not a fracture. Fractures are very uncommon in that area, but that's why an x-ray, or if you're concerned, doing an MRI can be helpful. Another misconception is that it'll go away if you give it enough time. But if it's not getting better after a certain amount of time, let's say a month or two, you probably should seek out a specialist, because just giving it more time might not be the best option. That's a misconception. And some people just think, well, just a bottle of ice, like ice water, rolling it on there and stretching is going to be enough. That may not be enough. If you try those things, give it a period of a couple weeks. And if it's not getting better, I would certainly see a specialist. And another thing that I see with many foot conditions is they say, well, doctor, what's the best cleat? What's the best shoe? What's the best thing to go in my shoe that'll make all the pain go away? Well, many times it's not just one shoe, because if that shoe existed, you would just buy that shoe. So be careful if someone tells you just have to buy a shoe to make all the pain go away. I think it's a combination. I want to go over some of the common mistakes that the patients make when treating Severs at home on their own. I think one of the biggest mistakes is parents, they're busy with sports with children, and so they wait too long to seek out help. I would seek out help a little bit sooner. If it's been a couple of months and you're not getting better, I would see someone. I would think of another problem. They think if they just buy another shoe or buy another shoe insert, so they spend all this money on different shoes and inserts and everything, and they're not getting better. That's kind of an error. If they have the incorrect diagnosis, many patients, they think they have something else. The kids might have something else like a fracture, and it's incorrect. And then wearing improper or no shoe gear at home or footwear at home. And then specifically, the main mistake is they're not loosening the calf. They don't understand the importance of the calf, importance of using physical therapy, foam rolling, stretching, and things like that. Those are some of the common mistakes that I see with patients. What are some of the common mistakes that you might see by a doctor? Well, one of the common ones, if you go to the wrong type of a doctor, if you go to, let's say, a primary care doctor that's not familiar with it, they might not make the correct diagnosis. If you go to a podiatrist, if you go to a physical therapist, or probably a pediatric orthopedist, they'll be able to make the correct diagnosis. But if they're going to help with the pain, but they're not really treating the underlying problem, failing to address the tightness or the equinus is a big one. And then failing to recommend a combination of treatment. I don't think it's just one type of treatment. I don't think it's just an insert. It should be a combination. They may make the incorrect diagnosis, specifically a pediatrician, if they're not used to seeing a lot of this, and they may not get the imaging that'll help. I have a couple of other questions that I wanted to go over. Patients ask me, how long should I try home treatments? I think with most foot conditions, if you're not better in 4 to 6 weeks, trying treatments on your own that you find that we talked about here, you should go see a specialist. And how do you get the best online treatment? Well, you should get a treatment if you're looking for things online from an accredited source, from someone that has experience, that sees quite a bit of this. That would be important, not just someone that has this hyper effect video that's going to influence you. When should you consider seeing a doctor? Another question that they ask me. And what type of a doctor? Do you want to see a primary care, a chiropractor, physical therapist, orthopedist, podiatrist? There's many different doctors you can see. In my opinion, you want to see someone that sees a lot of this. So it most likely be a pediatric orthopedist or a podiatrist. And you can't just treat it online. I don't think that's the best way just to treat things online. So I'm going to go and do a little bit of a deeper dive about all the different types of treatments for this condition. First of all, I want to talk about anti-inflammatories. Anti-inflammatories with kids, I don't do a lot of anti-inflammatories with kids. You can do it like periodically after a game or during a game, but I don't do it consistently for 2 weeks or for 4 weeks. I don't think that's the length of time that would be indicated for this type of a condition. Be careful if there's stomach problems. Prednisone, I don't normally do with kids either. And most of the kids, they just do over-the-counter anti-inflammatories. In terms of icing, how long should I ice? I like contrast baths if your child can tolerate it. So 5 minutes in ice water, 5 minutes in hot water. Once again, don't burn yourself, and then another 5 minutes in ice water. So that's 15 minutes total. That can work well. You can also take a bottle and put it in the freezer and roll the bottom on the bottom of the heel. That's a good way. You can also take a Dixie cup or a styrofoam cup and put the water in there, freeze it, and then rub it on the bottom of the heel. Those are kind of the ways of doing it. Do I typically do heat for this? I don't usually do heat. That's a question that sometimes I get from patients. Now we're going to go over some of the questions about reducing the tightness. There are many different ways of reducing tightness in the back of the calf. I specifically like to use a foam roller. If you can teach your child to use a foam roller, they can do that. I find stretching stretching isn't always the best, because when you stretch, it's actually pulling more on the back on that growth plate. So stretching very aggressively, such as putting your feet down on a step, isn't the best way, because that's going to put more actual stress on that growth plate region. I prefer foam rolling. There are sticks that you can use. There's something called trigger point tools. There are different balls that you can use. And everyone asks me, what's the best way I can develop a stretching habit? I think habit formation is real important when you're improving. I like to put it at the bookends of my day, meaning the beginning and the end of the day. So getting out of bed, doing some foam rolling, and at the end of the day, doing foam rolling, and then before some type of an activity. What's the best type of stretching? I personally like foam rolling. I think it's a versatile tool. Everyone has one. It's pretty easy to do. How long do I need to do it? 5 to 10 minutes is enough. Some patients come in, well, if I do it 10 times a day, will I get better faster? Not necessarily. Once again, going back to stretching, I don't think stretching is the best because it can pull on that growth plate as well. People sometimes do it incorrectly. What you can do is you can have your child lay down on their stomach, and you can actually roll it out for them with a foam roller, or I would just say find something that has some good ranking on Amazon. I can put some things underneath this video if you'd like. Some other areas. I have something on Amazon with all the different things that we're going to talk about in terms of treating Severs. That you might like. There's also a night splint that you could use. Not many of my patients do night splints, but it's something that you can wear to hold your foot up at a 90-degree angle. And that's helpful if you have pain getting out of bed in the morning. And also if you have the equinus, the tightness in the calf. I find with a night splint, you can wear it. Some patients can't wear it all night long, so I recommend that they wear it for about 3 hours. My patients ask me as well about compression. Is compression important? Is taping important? I think taping is fine. I don't do a lot of taping for my patients. If you have a trainer, they can try to tape your foot by giving it support. I like a compression sleeve, 15 to 20 or 20 to 30 millimeters of mercury. And that compression sleeve goes around from the ankle to the toes. It's a very easy thing. You can buy it online or at a store. And that compression just holds everything together and makes it feel a little bit better. Everyone asks what type of compression. As I mentioned, 15 to 20 millimeters of mercury or 20 to 30 millimeters of mercury. I think compression or a compression sleeve is much better than taping. It's just easier to do. And I think whatever for our patients, it's easier, we're going to do. Everyone comes in and they ask about these padded arch supports. If you haven't seen these, it's an elastic band that goes around the foot, and it has an arch in it. And I don't find these all that beneficial for this specific condition. And I also don't use a walking boot, which is a cam boot, very often for this condition, just because I think it's a little overkill, especially if unless it's really, really severe. I don't use a walking boot. And very rarely as well do I use a brace. There is a special kind of compression sleeve / pad that they make. It's called a Thule's heel cushion, and I'll put a link underneath here to that one. It has a compression sleeve that's going to give it compression, and has almost like an eggshell. It looks kind of like an eggshell or a honeycomb underneath it, and that it distributes the pressure on the bottom of the foot. That is an over-the-counter type of device. And my patients always ask me, what's the best shoe for my pain, for my child's pain? The challenge is for kids, they usually are getting this problem when they're in cleats. So you need to, if you're going to do any device, that'll have to fit in the cleats. If you're going to do an orthotic or an insert, that's going to have to fit in the. But if you're just going for a normal shoe, I personally like Asics, New Balance, Saucony, Brooks, Hoka's, things like that. They have added cushion in them based on the child's arch. You might want to do something with a little bit better of an arch support. An over-the-counter insert, you can try that. Specifically for kids, we like to use something called a UCBL, which is a deep heel cupped orthotic that's going to help stabilize the heel. And I think that's very beneficial. I would avoid, when you're recovering, going barefoot. So there is a good flip-flop that I recommend. If you have a pediatric size, it's called an OOFOS, an OOFOS type of a sandal or flip-flop or slide. Orthotic, like I said, the one I recommend is a UCBL. It's a deep one. Most pedorthists or podiatrists will be able to get you that. There are some ones that you can try over the counter that have kind of a mimicking of a UCBL over the counter one. You can try that. If that doesn't work, I would do a custom one with that, and that'll fit inside of your shoe, and you'll wear it until the symptoms go away. Once the symptoms go away, you can stop wearing that. Orthotics, they take about 4 weeks to make. If they're made custom for you, they last about 5 years. So you'll probably grow out of it before you get done with using it. And most of the time, actually in Massachusetts where I live, they're really not covered by insurance much of the time. So now I'm going to go over and talk a little bit more about some of the physical therapy modalities that can be done. I find stretching okay, foam rolling better, but then physical therapy, many of my patients, they get better faster with physical therapy. There's a specific tool that physical therapists do called the Graston technique, where they rub on the bottom of the heel. Patients always ask, what about acupuncture or a chiropractor? I think they're okay, but I don't find them as effective. And how often will patients go to physical therapy? Usually it's 2 appointments a week for 6 weeks or so. And you can ask your doctor for that. I find that the accountability of going to physical therapy gets people better faster. Can't I just do it on my own? You can try it on your own, but if it's not getting better, I would go see someone. There are some advanced treatments as we're finishing up this tutorial on Sever's. One, I want to be clear, I do not do this on many patients, but there's something called shockwave therapy for really kind of ones that aren't getting better. What shockwave does is it helps increase the healing. It hasn't been known to close the growth plate prematurely. That would be the main concern. Is it going to close the growth plate prematurely? But it's a treatment that helps speed up the healing by increasing the blood flow to the area and also loosens up the tissues. I haven't had much experience with it, but that's something maybe for the future that we could do. But as you can see, Sever's, there are a lot of different treatments. There are some great websites. I'm going to put some resources underneath here on Sever's. And certainly if you have any questions, you can post a question after this video. Okay. If you are living in Massachusetts and you're dealing with this, certainly come in to see us in the office. Happy to answer any of your questions here in the office. And if you're a patient of mine, thank you for seeing me. I'm going to be giving you this video if you have a child that I'm seeing. Okay. Thanks.